All right, everybody, welcome to our presentation. My name is Snizhana Weber, and this is Alan Sapp. So I am an exercise physiologist for North Kansas City Hospital, and I do outpatient cardiac and pulmonary rehabilitation. And Alan is
Respiratory Therapist. I do outpatient pulmonary rehab and PRN respiratory therapy inpatient.
So today we're going to have an awesome presentation. So we will going to cover as much as we possibly can. And everybody will have an opportunity to go online on YouTube and watch it again and just share that presentation with people that might need that or will benefit from that. And it's going to be free access on North Kansas City Hospital channel. So today we are going to have discussion on resuming physical activity, safely resuming physical activity. So we're going to talk about some challenges that some patients might face, and we will give very specific recommendation what you can do to overcome that. We're going to talk about specific exercise recommendations, and we're going to discuss breathing technique that a lot of people, if they will practice, they will find it very beneficial. Not just to recover from COVID-19, but just kind of use it in everyday activities as well. So a couple of things, I just want to mention that me and Alan, we actually work directly with COVID patients. That's what we do on Tuesday and Thursday. We see a lot of post-COVID patients, and we started seeing them back in July 2020.
Yep.
Okay, so we have a lot of experience, about a year. A bit longer than that, so we have a pretty good baseline to see what those patients have challenges and what symptoms they have and how can we overcome and do good rehabilitation for them to resume daily activities that they used to do before they got sick. So I would like to start and actually talk about common challenges that some patients might have post-COVID, and a lot of people might wonder if that's normal. Am I okay? What's going on? Am I the only one who might have those challenges that they're facing? So we just will go and talk about kind of what we see in our rehabilitation. One of the most common symptoms that we see is fatigue, specifically fatigue after any type of pretty much minimal physical exertion. So our patients come and they do pretty light exercise, and by the time they are done and getting home, they will just have to have a couple hours of nap. They get really tired. So it's inconvenient, and we do understand that, but we just kind of want to encourage everybody keep moving and kind of remembering that you guys been through a lot and you had a lot of challenges, and that's something normal that you're going to face with that physical fatigue, mental fatigue after physical or mental activities. We also in our rehabilitation actually monitor every patient we see. So they have a little monitor and EKG, and we can look at activity of heart, and we're looking at heart rate and blood pressure, things like that. And what we see that some people might have elevated or pounding or fast heart rate. So we can communicate with patient and a healthcare provider, just kind of keep an eye on it. But again, when you think about COVID, I think that it actually does attack, vascular system, and it will have impact on your cardiovascular system as well, and have a high heart rate. Just kind of be aware. Joint or muscle pain that you might not have before because it has to do with neurological, maybe some little dysfunction. Shortness of breath with activity. If you've been in the hospital for a long time, you are going to lose lean muscle mass, and that will be the shortness of breath, even sometimes with activity. And Alan will talk about specific breathing technique and how we can outcome that and actually, feel good and breathe better. Difficulty walking. I see a lot of patients, if they had some type of neuropathy before, it's actually probably more intense post-COVID. And difficulty thinking or concentrating, brain fog. I know that our physical therapy in the hospital actually worked with the patient who have brain fog or concentration problem post-COVID. So there's something can be addressed and work on. Dry cough, so that especially with exertion. So we see those symptoms with patient, and chest or stomach pain. So we see a lot of patients who have some type of chest tightness, especially around their lungs. So I would probably want to say it's normal, right? So it's not it's normal post-COVID. So we, again, as you are recovering and getting better, that type of tightness or chest pain or pressure hopefully will decrease. And I, guys, cannot change my slides. Let's see if I can. Here we go. I just need to push more aggressively. Okay, so let's talk about exercise, right? So when we think about, resuming everyday activity and exercise, what we want to think about is not just, I need to walk. So there is a lot of things comes to, get your whole body, back in shape and moving. So cardiopulmonary, so which is a cardiovascular exercise. A lot of people might know those exercises, aerobic exercises. That's good for your heart and your lungs. So we want to get that stamina up, right? So you lost a lot of stamina, you lost a lot of strength while you were in the hospital. So we want to make sure that you're feeling good. So cardiovascular, that would be kind of a light walking, biking, and things like that. Balance and coordination. So kind of specific exercises to work on that aspect. Especially, I see a lot of people post-COVID actually struggle with balance and coordination, especially if they had, little balance issues before. It's kind of more intense now. Muscles and joints. So we want to gain these strengths back, and we know that patients who in the hospital for a long time lose a lot of lean muscle mass, and that contributes to more shortness of breath and more fatigue. So we really want to concentrate to getting those muscles strong and regain muscle strengths, and kind of like I talked before, mental and cognitive, so which is brain and thinking. In our rehabilitation, we are not specifically concentrating on mental or cognitive aspect. We have a lot of education on that, but again, what we do is more cardiopulmonary balance, coordination, muscles, and joints. So that's when you think about resuming your activities, that's what I want you to start thinking about. Hey, I need all those things. I need to start doing all those things to get back to my normal activity. Couple things. So I think that being sick and not feeling good and just such a slow recovery for a lot of people, we want to make sure that you definitely talk to your physician and be guided. So what is your next step? So we don't want anybody just sit at home and feel like, it's the end and there's nothing they can do. So that is, you have a lot of options, to have a good professional recovery. So definitely be guided by, exercise physiologist or respiratory specialist or nurse. Your physician just kind of guide you through what options do you have. Okay, we would like everybody to remind that you need to respect your current fitness level. Do not reflect back and think, I used to do all those things and now I cannot do that. So we want to start where we are so that we gradually, can increase your intensity, duration, get where we need to be. The most common mistakes when we really think about guidelines for exercise, a lot of my patients kind of skip warm up and cool down. They just kind of go and really cannot, their intensity cannot match demand that their body puts on. So definitely start nice and slow. And when you're done with your physical activity, you take time to cool down, to stretch, to breathe, to relax. So it's very, very crucial. So it seems like it's basically, maybe person doesn't do much, but it does a lot of good things for the body. A little breathing technique, Alan will go over that in a couple minutes. And don't forget, if you really feel worn out, tired, take a rest. So specifically, I just want kind of mention that exercise should make you feel good. So if you're not feeling good, probably not going to keep up with that type of exercise. You want to take breaks. When to stop exercising. So this is kind of what we want to look at: discomfort or pain, something unusual, right? Something that you have not had before and now you have. If it's just discomfort or pain because of inactivity, I would not stop exercising. I would still, get more. Extreme breathlessness, right? Something that may be unusual for you. And I already mentioned, heart rate, rapid heart rate, irregular heartbeat, something that you feel that can be abnormal for you. So I would definitely address it with your physician. So when we really think about, recommendation for physical activity, so what if you watching this video and you're like, okay, I got it. So I know I have all those symptoms, all those challenges. Where do I start? So I would probably start with just 2 days a week, right? Sounds like, oh my gosh, is it enough? Yes, it's enough. So you were not inactive, for quite some time. 2 days a week is pretty good. We actually see patients twice a week, on Tuesday and Thursday, and they have a great result just coming and exercising with us a couple times a week and doing something light on their own. Example, slow walking. Bike, something they're sitting down, light resistance training. So when you have really light weights and have those high repetition. I did kind of mention, and I put heart rate 70% max. Most people probably really don't know what does that mean. In our rehabilitation, we kind of help people to see where your heart rate is supposed to be. But again, talking to your doctor and say, hey, what is my healthy heart rate? Where should I be? If it's over 100, usually it should be over 100. So, but when it's high, it's too high. So this is something that, like we mentioned before, talk to a professional about that. Start with 15 minutes, 10, 15 minutes, nice and light, just kind of slow, get to your routine, don't power through. We see that a lot, right? So most people like push. And we really don't want you to do that. We want you to enjoy it. We want you to take time. When we see patients, we always mention, hey, you just have to be patient. Practice your patience, trust the process, trust us. We will get you where you need to be. You just need to take your time. And for everybody, it's different. And some people probably would still have challenges 6 to 8 months, since recovery. Some people recover a little bit better. So we see different type of timelines. So I can't even say what is the timeline. So I think it depends.
Yeah. We're all learning from the patient.
Yes, exactly. So we don't know. We just want to make sure that we have appropriate exercise for you, and we progress and help you based on your needs. Do you need to go back to your job? Are you active with your grandkids, or like doing social things? So just kind of based on your needs, we're going to do exercise recommendation. And something that I always talk to my patient, that it should be, again, baby steps, and start with time. I would rather you walk a little bit longer, but slower, than go fast, and not to be able to sustain, your intensity. We see a lot of patients, they come and they can't do anything for 5 minutes, and by the time they do rehabilitation with us, they're able to walk up to 30 minutes nonstop for pretty good pace. So again, there is obviously hope, and you do have a lot of options. And so if you have any questions, we will wait until the end. And Alan will take over and talk probably the most crucial topic, how actually do I breathe, and what breathing technique should I use. You want to switch?
Okay, I'll talk about a couple breathing techniques that we teach all patients with lung disease, but we found that it's helped patients with COVID. First one is pursed lip breathing. Pursed lip breathing helps to prevent collapse of the lower airways, slows down your exhalation time, helps trapped stale air get out of your lungs, and improves your ventilation. The technique to use this, and I'm just going to lower my mask for just a minute so you can see. Breathe in through your nose for about a 2 count. Close your lips tight like you're blowing out a birthday candle. And exhale for about 4 seconds. You're going to keep your lips tight so you kind of create some back pressure in your lungs. You want a nice, slow exhalation period to get all that stale air deep down your lungs, up and out. And don't force the air out, just kind of let it fall out. So personal breathing can help you catch your breath when you're on the treadmill, walking fast, or even if you're just short of breath from doing your taking a shower, doing your dishes, anything like that. So you can use your pursed lip breathing anytime. The next one, diaphragmatic breathing, is to retrain your stomach how to breathe properly. It improves the function of the respiratory muscles, enhances the effectiveness of ventilation. It makes work of breathing easier. Your diaphragm is the main muscle that your lungs use for inspiration and expiration. So if you strengthen that muscle, it'll help you breathe a little bit easier. Okay, so do the belly breathing. Take a big deep breath in and you want to extend your abdomen out. Then when you exhale, suck your stomach in. One more time, big deep breath in, belly out. Exhale, belly in. That'll activate that diaphragm, that main muscle that you use for breathing. Your diaphragm is right below your rib cage, right up top here. Right around there. Okay. Any questions? We'll start the Q&A here soon. About pulmonary rehab, we do meet every Tuesday and Thursday. If you are interested in starting pulmonary rehab, contact your doctor. You do have a referral from a doctor. After your doctor sends in the referral, we can call your insurance company and we will take it from there. We'll go ahead and start the questions here.
All right, there's no questions yet. And we left our information in the end. So our email, if you need handouts, they will be available for everybody. So one kind of look over, breathing, personal breathing technique. Sometimes, like Alan said, it's all practice and teach. So we just make sure that you guys start practicing that with in our rehabilitation or on your own. But things you can do, to get base, to get your breath under control, and really know how to do that when you are active. And relaxation technique, like Alan said, diaphragmatic breathing technique, if you have a trouble sleeping or something like that. And again, I just want kind of encourage everybody to have a discussion about options. And one of those options is outpatient pulmonary rehabilitation. You can go to North Kansas City Hospital website and just search pulmonary rehabilitation and just read about us. This is 69175, our direct phone number. So you can just give us a call and just say, hey, can we just chat? I have questions about, the program and where you are and what you do. And so can stop and visit as well. So we welcome everybody. So if it's a busy class, probably we always available for anybody who wants to know about us. Something I don't know if we said, you don't have to have pulmonologist.
Any physician can write an order for pulmonary rehab. It doesn't have to necessarily be a pulmonologist. It can be a PCP, and your cardiologist, but it doesn't have to be a lung doctor.
Yeah, it can be any type of physician who just have a referral, and like Alan says, we'll look at insurance and guide you through. So patients will have 18 sessions with us. It's all exercise sessions, and that's what you do. You are doing rehabilitation. It's a physical activity, exercising with us twice a week. We have, thank you. I just make sure that thank you. We have different type of equipment, from treadmill to bicycles, and you step up body. So there is a lot of options. Also, we have education before solid 15 minutes. So it's anything from, healthy blood pressure. We have dietitian that comes once every 2 months, right?
Once every month, once every other month.
That's right. We actually added more, diet classes that dietitian will come. We have our pharmacy, and Alan talks about everything that is lung related. And we have a fantastic nurse, Lori Pistana, on our staff, and all the clinical things. She's our guru who will resolve and kind of at that. And we kind of go and help patients with exercise aspect. So, but we are very involved, and it's for people on the team. And in addition to cardiovascular exercise, like we talked in the beginning, we also doing resistance training. So it's pretty good. So when you come and see us, it's a pretty full exercise routine with cardiovascular exercise, resistance training, stretches, and relaxation. And again, if you right now listening and wondering, my goodness, that sounds a lot. I have not been active forever, or I really have never been exerciser. I would say more than half of our patients have never exercised before. So there's nothing to be worried or be intimidated by that. We're going to meet you where you are and start you, based on your limitations, knees, hips, any other, challenges somebody might have, and progress you and help you out as we go. And again, if you decided that that's not an option for you, I would probably encourage to check, North Kansas City Hospital YMCA facility and see, what is available there. Can you meet with exercise person and help you out with your, simple exercise routine? Or, there's a lot of options if you do have Silver Sneaker, which is insurance-based program. So it might be an option to do it for free. All right. We don't have any questions. I always say if people don't have any questions, we probably did a fantastic job and covered everything we should cover. Again, feel free to give us a call. This is our direct phone number. And if you prefer emails, you can email to us, or if you like, just stop by and say hi and just kind of see where we are. We're on the 4th floor pavilion, I probably should say that, where we're located. So it's super easy to find us. So we are not hidden somewhere. So just see us and stay healthy, and thank you so much for having us. And hopefully we will have web series like that in the future, and we did a pretty good job, and you'll be invited back. Okay, all right, thank you so much, guys, and we will see you soon.